Hi, how are you? My name's Frances Seaslake and I'll be the nurse interviewing you today. So take a seat and lovely to meet you.
Lovely. Thank you.
Thanks for coming along today and thank you
Welcome.
for applying to our health service hospital for a graduate nurse position. So that's terrific. And as you'd probably expect, we're going to ask you a few questions. So if you could just answer them as best as you can. Try
Sure.
not to be too nervous. We won't bite. We just want to get to know you a little bit better and to make sure that you're a good fit for us and that you'll be successful in our graduate nurse program here. So, if I can just begin, would you mind telling us a little bit more about yourself
Sure.
and some of the qualities that you think you will bring to your nursing as a graduate nurse?
My name is Mohammed Tahir, and I have done my bachelor's of nursing from Homeschooling. Um, a little bit about my background. I lived with my aunt back home in Pakistan, and she's a nurse. I grew up in an environment watching her how much she loves to do nursing every day is both inspiring and motivating for me. I love facing new challenges and thinking outside of the box to come up with solutions. It keeps me exciting and engaged. I'm proud to continue the tradition of nursing in my family. Above all, knowing that I'm truly making a difference in people's lives is what truly makes it all worthwhile. Nursing is my passion. I love providing comfort and education to those in need and intervening in difficult situations. I'm very proud of my ability to listen to patients' concerns. At my clinical placements, I learned that addressing their concerns and making them feel that their concerns are genuinely heard was just as important as receiving quality care.
Okay, thank you. May I also ask you why you want to work at our organisation? What was it that made you apply to our hospital?
I'm fascinated by the new and emerging technology involved in ongoing patient care, especially in the acute medical and surgical healthcare environment. In Langdon Health, it is a large tertiary public healthcare service in Melbourne, as Langdon Health is known for Center of Excellence in clinical trials and research, particularly in cardiovascular, respiratory, and infectious diseases. So I'm really excited by the possibility of being a part of that and learning from your experts. I not only want to continue learning, but to meet and work with amazing nurses at your hospital. In particular, the nurses I look up to and the nurses I aspire to be like.
Okay, thank you. Um, can I ask you what your particular interests are and what your sorry about that, that's my
That's all right.
phone.
That's okay.
What your particular nursing interests are and why you're interested in those areas?
Um, I'm confident with my prioritizing skills and managing illnesses and injury with rapid interventions to prevent death or disability and restoring optimal health of my patients I'm caring for. In acute medical and surgical healthcare environment, patients are often decline quickly and without warning. Therefore, I actually want to put my skills and I want to test my skills to react quickly and efficiently during high stress situations. Emotions can run high during these events, and I think I can add great value in acute healthcare setting by practicing empathy for patients and their families, especially with severe or life-threatening emergencies. I'm enthusiastic to use my critical learning skills to provide patient-centered care.
Fantastic. Just a couple more.
Yeah.
The other thing I'll be interested in knowing is a little bit more around how you deal with conflict, or if you've ever been in a conflict situation, that might be with a colleague or even a manager. How have you dealt with that situation? What's the sort of strategies that you use to manage conflict?
At my current employment, I had an issue with one of my colleague who was working in the same industry for last 10 years. And instead of escalating the issue, I asked my colleague if I could talk to him in back of the office, and I just addressed that issue. I was careful how I worded the things because I didn't want to make it seem offensive and attacking. I just treated as I wanted to work something out, and we sort out our concerns in private. And for both of us, we actually ended up having a good friendship at work, and which actually provide us good insight of how we can solve things and solve conflicts between among of us.
Okay, thank you very much. And finally, I'd like to ask you a clinical question, if I may.
Yeah.
So you're working on a general medical ward, and you have 5 patients under your care.
Yeah.
4 of those are in a ward situation, and one of them is actually being nursed in a private room
Yeah.
with some infection control measures in place. You've just left that room, washed your hands, and all of the usual things, and you actually go in to help a 79-year-old gentleman transfer from bed to chair. He has a history of AMI, and he's complaining to you now. He's the chest pain, feels short of breath, and actually, as you're about to transfer him, collapses on the floor. Can you please talk us through your immediate response and your immediate clinical actions that you will take in the event that this occurred to you or during your shift?
Sure. I will immediately call for help. I will check for breathing and pulse. If there is no response from the patient, I will immediately call a code blue. If the patient is conscious, I will perform head to toe assessment, and starting from the neuro check if the head is all right, and if so, I will commence neuro precautions thereafter. I can get a full set of vital signs. If I'm getting some help from other nurses, I can just tell them, or to give me a hand, or I will just do it. Set of forms, and after that, we can administer some oxygen on that patient because he's feeling short of breath. We can immediately do ECG, and just because of the patient having chest pain and history of acute myocardial infarction, we can check, like I will check for bruises, any broken bones, scrapes or bumps on a physical assessment, and I will fill out the incident report immediately, and I will call the doctor and inform the family as well. I will certainly get some help, to lift the patient off from the floor. If they can't do it on their own, of course, if they're unconscious, or if they have some injury, it's better to use a lifting machine to mobilize them from the floor to the bed.
Okay, thank you very much, and thanks for coming in. And again, lovely to meet you, and all the best. We will be in touch within the next week,
Yeah.
and then we'll be able to let you know how it all went.
Sure.
Okay,
Thank
lovely.
thank you
Thanks
so
very
much.
much.
Thank you.